we've always had this chronic shortage of healthcare workers, or at least, for the last 10, 15, 20 years since I've been looking at the space, this ongoing shortage, it's gotten even more intense. The pandemic sort of lit that on fire. We've got an aging healthcare workforce. And so, that shortage, I think, is just an ongoing trend that's like a fact of the world in terms of healthcare workers. It drives a lot of things. One of the things we're seeing with strikes and other is, that the talent is increasingly in the driver's seat. And so it's on the shoulders of the executives running healthcare organizations, the folks staffing those organizations and others, to really adapt to this new reality of, how to make work better for the workers who are out there, how to deliver them the flexibility that they need, how to give them the deal that's going to be attractive to them and their life. So that trend has been front and center in 2020, 21, 22, now 23. It's not going to go away. On top of that, the other big thing, and maybe related to that, has just been the pandemic, how that's lit that on fire, how that has opened people's eyes to new ways of working, to maybe some new models, to ways of thinking about the problems differently. And, we've seen a lot of the volatility and things that have come through there. And then finally, I would say the impact of technology. And so we talked a little bit about AI, where we've seen a big impact in healthcare staffing in the shorter term. It has been around what we would call sort of the self-service revolution, the digital transformation, the platformization of healthcare staffing. And part of this is driven by workers, and as the newer, younger workers come into the workforce, into the healthcare workforce, they're much more comfortable with a self-service model than older workers. I think about my kids who are in their early 20s. The thought of picking up the phone and having a conversation with an adult is sort of terrifying. And
so scary.
They'd much rather do the research themselves, and they'll talk to somebody if they need to. But if they've got a very specific question, we saw that happen in healthcare staffing over the last, over these past couple of years. The big growth in self-service platforms. It changes the role of recruiters. The recruiters are doing less of the hey, I've got a great job for you here, and more of the, okay, you've found the 3 great jobs that our system matched for you. Let me tell you more details about this. Let me answer your questions. What can how can I help you be prepared?